Oh baby, it's Wednesday, May 20th, and we're here at Ocean Springs Hospital on the 3rd floor with our women's and children's team. We're going to meet them in a few minutes to talk about how they are protecting themselves and our guests and the newborns from the COVID pandemic. But first, we're going to kick it to Lee for the stats for the day.
So today we are approaching almost 4,000 tests we have done since inception. Unfortunately, we had 4 positives today, so I got to preach a little bit. You guys, we've got to get people to where they're paying attention. If you're around somebody that's coughing, stay away from them. Put a mask on them and lock them in a room. But seriously, we've just got to be more careful out there. To have 4 was not good news today. And that's just a sign that people are letting their guard down a little bit. Please stay focused and keep your guard up. But
yes.
Anyway, let's talk about good stuff today.
Absolutely. So today we have Lori Weiner, and she is our Weiner's at Weiner.
Yes, fine.
Sorry, Lori.
I answered anything.
And Ms. Vicki here, she's a nurse on the floor in our women's and children's labor and delivery. So tell us, how did you get into delivering babies?
So I got into delivering babies coming from a med-surg background. Always wanted to do pediatrics. Went to pediatrics and then had to go to the nursery a little bit, went to the nursery a little more, went to a few deliveries and got hooked. Absolutely got hooked on labor and delivery and have been here about almost 30 years.
So Jamie, why do you do that? What makes you do this? What makes you choose labor and delivery as the area of work?
I just, nothing against men, but I just like working with women. I really do. And, like being there for a woman's one of her most memorable moments in her life, the birth of her children.
Bringing life into the world.
Yeah, I mean,
what's better than that?
What's better than that? Exactly. So I jokingly say that this hospital system will have to kind of kick me out because I just can't imagine doing anything else. Like it's absolutely enjoyable. When you find something that you enjoy this much, it doesn't really feel like work. And so anytime I'm here, I'm just enjoying every minute of it. It's hard to get up at 5 in the morning to get here, but once I'm here, like I'm on spot and ready to go. So we jokingly talk about we're probably a little bit of adrenaline junkies because labor and delivery is just like that. One minute it's kind of
boring.
Yeah, exactly. 1 minute everything's kind of chill and quiet, and the next thing you know, 2 or 3 people walk in the door in labor. So. Yeah, never a dull moment.
Yeah, I can't think of a better thing in healthcare to be a part of than bringing new life into the world.
It's beautiful.
It's got to be the greatest thing ever. So
anyway,
lucky y'all to work in this
yeah.
area.
Yes.
Tell us a little bit about this area where all the rooms are full right now.
We're full.
Statistically speaking, Sarah, all of our stats for hospitals nationwide have been down a lot, but labor and delivery in Pascagoula, Ocean Springs, Singular Health System has been up. We've actually had more babies than normal, which is great. But all the rooms are occupied right now up here. Tell us a little about this area. This is not an actual regular patient room. What is this called?
Sure. So this is the evaluation room, the first room that you will come to when you come to the hospital with any kind of labor concern or any concern with your pregnancy. We'll bring you in here and your nurses will evaluate you, see what's going on, let you kind of talk to them, and they'll communicate with you, and then they'll communicate with your physician, and then we make a plan of care based on that. Maybe it's to go home, maybe it's to come and have a baby, but this is the first room that you'll see.
Well, I'm glad you have some room for us. It's awesome that everyone's feeling that they can come in with everything going on. That's one thing that COVID can't stop is, Mother Nature and people having babies. So how have you guys, adapted to the new norm of the visitation and making sure that, mothers feel comfortable while they're here when they have limited visitors?
And safe.
Yeah. We've done quite a few things. Other areas of the hospital weren't allowing visitors at all, but we were allowing our patients to have one support person here with them, their choice who that was going to be, their husband, significant other, mother, whoever. And so we were kind of bringing them in behind our doors. We're a locked unit, bringing them in behind our doors, and they kind of stayed with us until they were discharged home. So we did that. We've taken on a lot of other roles too here, like drawing our own lab work on our patients rather than having phlebotomists coming in and out of our doors. Doing outpatient labs on our babies so that our babies aren't downstairs in outpatient areas. They come straight up to us where we're very confined to kind of, a controlled environment, and doing those kind of things. Feeding our patients significant others for a while just so that they wouldn't have to be out and about going down in different areas of the hospital or trying to go out of the hospital to try to get meals. So lots of different things that we were doing to try to make sure that our patients, both our moms and our babies, were safe during this unprecedented time.
Including our staff being super conscious about closing our circles, not seeing anybody that didn't live in our house, not going to the store. I mean, we've been very creative with how we're using, Walmart pickup or different things like that, just so that we are protecting protecting ourselves so that we're
protect
not
our
bringing anything to
patients.
work.
Yeah.
Lori's been proud of you guys, and I'm proud of her for, and all of you for taking this so seriously. And it's been shown that women that are pregnant, due to maybe a little bit of suppression of the immune system, are a little more susceptible potentially to COVID. We haven't had any
Right.
positives, but
Thank
we're
goodness.
prepared for that if that should happen.
Right, we're
Yes.
completely prepared to take care of COVID patient. We've drilled on it. We've made a planned a room. We've got all the supplies we need. We continually keep up with the research of other hospitals
Yep.
and people that have seen COVID patients so that we know the best practice, the best current up-to-date practice of what to do with those patients. So we are prepared.
And you've also been preparing for a long time now to get this baby-friendly
Oh, yeah.
initiative underway. What exactly does that mean, and why is it important for our new moms to know about it?
So this Baby Friendly is a 4-year journey to be certified Baby Friendly hospital, and essentially what Baby Friendly wants you to do is teach the very best nutrition for babies. And for most babies, that's mother's milk, because that's the milk that's made for that baby. And for the things that are going on with that baby, if a baby's sick, that milk changes to meet those needs of a sick baby. Not every baby can be breastfed, and we understand that. And so we also take a lot of time and care in teaching our moms who are going to formula feed how to prepare formula, how to be safe, how to do those things that naturally happen with a breastfed baby, like switching arms when you feed the baby so that their eyes develop equally, and different things that happen with babies developmentally. Also, initially we're putting the baby skin to skin. Even in the OR, we're putting them skin to skin. That skin to skin contact, it releases hormones for both mom and baby that regulate baby's blood pressure, temperature. They're just calmer, they're happier. It also starts mom's hormones, thinking about making milk, and brings her blood pressure down. And it's really, there's so many things that happen that are scientifically researched, and it's based on real facts
It
about
is science. and it's-
perfect things that happen with this interaction with mom and baby initially right after birth.
When I first heard about it, I was like, baby friendly. That's a certification. Why isn't everybody friendly to babies?
Yeah.
But then what I heard is Blue Cross, a huge company, one of the largest insurers in the nation, the science behind it, they have said, look, places like Senior Health System that get into this program, we're going to certify them because we know scientifically it yields a healthier mom and baby. So I'm very happy that you guys decided to pursue that.
Right.
And the
program.
patients are happy. Like they're happy that, some moms, most moms, come into our facility, into a labor and delivery room, deliver their baby, and their baby never leaves their eyesight
Ever.
Yeah.
So that's a wonderful thing. Years ago we took babies away
Put them
from
in
their
the
moms and
nursery.
put them in the nursery. And so now we know science tells us
Right.
that's not really the best plan of action. So that's pretty unique that a mom will have that baby and never leave their side. I mean,
Right.
so that's really, really a wonderful thing for
So
mom
I
and
like
baby
to
both.
talk about differentiators and what makes you guys, better, that why people should choose you guys as a health system and choose us. And obviously that's one reason, but tell me what else is something that sets you apart or makes this the place at Ocean Springs or Pascagoula hospitals for somebody to come and choose to have their baby here. What's special about y'all?
Well, I think there are a lot of things that are special. I think the staff is wonderful, the nursing staff, as well as the ancillary departments that deal with our patients, the obstetricians, the pediatricians, wonderful, wonderful medical professionals that take care of these patients. Our facilities are beautiful. They're beautiful facilities. We probably have some of the largest LDRPs, labor, delivery, recovery, postpartum rooms on the whole coast. And patients will say it all the time. They'll walk in and this room is so big.
Yeah,
It's a
that's
beautiful,
awesome.
beautiful facility. And some really kind of neat things that go along with that. We have bidets in some of our rooms, so
Yeah.
patients can use a bidet after having their baby. I thought it was the craziest thing, and I thought, I got to try this bidet thing to see if this is really true. And so when I tried it, I was like, okay, every mom who has a baby needs a bidet.
Bidet for
You need a
everybody.
bidet for
Friends.
everybody. So
What about technology?
yeah, we have some wonderful technology. We have what's called central monitoring in our department, meaning anytime if you're here having your baby and your baby's being on a fetal monitor, tracing the baby's heart rate and your contractions, we have monitors in every room in this facility, as well as in our doctor's break room, in our OR, at our nurses station, where we can monitor your baby's heart rate during your entire labor process. So that's pretty special. And patients are really kind of surprised when I say, well, I'm taking care of you, but I'm going to the next room, but I can still see your baby's heart tracing as I'm in that room too. We have wireless monitoring, which is wonderful. It gives patients much more mobility. It's really it's almost kind of sci-fi when you go in and see this little blinking light on their belly, because they have these little electrodes, and that's the wireless monitoring. It's just this looks like little EKG pads stuck to their bellies with a little monitoring device. But that's neat because it gives patients the ability to ambulate in their room. They can sit in the bedside chair. They can sit on a birthing ball. Even walk out in the hall. It has pretty good range. And when it works, it's really phenomenal. So that's pretty special too. And we find that patients who want to have less intervention with labor really enjoy having the wireless monitoring. So that's pretty awesome.
That's awesome.
Yeah.
We have some low-tech things that are actually
Yeah.
pretty fun too. We have peanut balls that help people to, as they're laboring, helps to open the pelvic outlet and kind of, gives us a better chance of having a natural vaginal delivery as opposed to a C-section, and birthing balls. And
You always get some eyes looking at you when you're like, I'm going to go get the peanut ball for you. And the patient's like, what? The peanut ball?
Well, there's a lot of technology, the certifications and everything, but clearly the biggest thing we've got is you guys. And our
absolutely,
people.
we have
And
the most
just to hear you
vintage
talk
nurses.
about these things and your years of experience. How long you been here,
I've been here 25 years.
Jamie?
I've been here for 20 years here at Ocean Springs.
Yeah, and you were in Pascagoula
I was in
before that,
Pascagoula
right?
before that for 4 years.
Yeah, so that's, to me, that's the most impressive thing. We get a lot of comments about you guys, and you can hear just talking to Jamie, why do people want to come here and why they have such good experiences. So
Well, and I know, like, you and I've had this discussion before,
Yeah.
because I've talked about this, like, nurses aren't here just because this was the job available.
right,
They're here because they want to be here.
This is their
It's
passion.
tough.
This is where they want to be.
tough hours.
Yeah,
and
it is.
tough
It is.
things to deal
It
with.
is.
Yeah, you
So-
convinced me. Maybe I'll go later.
Yeah.
But anyway, so the doctors, everybody, how you guys work together, hand in hand, have close relationships with them.
We
Yes.
spend a lot of time with
A
our
lot of time
doctors.
with them.
A lot of time waiting on babies with
Yeah.
our doctors, so we
Yeah.
know them well.
Yep.
What's it like working? So I'm in meetings with like Dr. Horn. What's it like working with him? Can y'all tell? We can't really talk to him.
Never
Is
a
he as
dull
fun?
moment.
Is he as fun up here? as
Yes,
the meetings?
never a
absolutely.
dull moment. Never a dull moment. Matter of fact, and I'll say this. He won't care if I say it, but I just told a patient today who said it was his patient. And she said something. And I said he is a hot mess. And she said, "Yes, he is a hot mess."
So which doctor is y'all's favorite? Wait, don't. We'll tell after the camera. We can't tell. Do you have a favorite?
No favorites.
No favorites.
We love them all the
all
same.
Favorites.
Yeah.
We love them all one day and want to just strangle them the next. It's just,
Or minute or hour.
I love it. We are very fortunate and blessed to have good doctors as
We
well as
are.
good
They're
nurses.
really good.
They're really
second to
some of
none
the
right
smartest doctors.
Yeah, they really are. They're just really committed. I mean, they're there for us when we need them, meaning us and their patient. And they're
They're
these
very
guys,
passionate
they are
about their
passionate.
care. They're very, they care a lot about their patients.
Yeah.
And yeah.
So what would your
absolutely.
advice be to a new mother about this whole experience? What would you tell them to do before they come in?
Oh goodness. I mean, I think it's great to be educated. So, I mean, I think that's wonderful to be educated. Asking questions, talking to your physicians, telling him about some things that you want to see happen when you come in to have your baby. I always tell patients that, like, clear that with your doctor. Have that discussion with him. Tell him what you want. Let him tell you what it is that he wants.
Or she,
And you, so that you guys can make a plan and have that plan when you come in. So I think that's real important. But also too, rest assured and trust us. We're going to take good care of you. We're going to take good care of you. These doctors are going to take good care of you. That is our goal. Healthy mom, healthy baby. That's what we want to see happen. And we can make that happen for you so that you have a great experience, a lasting, beautiful memory of the birth of your baby here at Singing River Health System.
Yeah,
without
so
a
to
doubt.
tag on to that, I always say just relax and enjoy it. We're going to worry for you. We'll tell you everything you need to know. We just want you to love this time with your baby because you're not going to get it back. So enjoy every minute of it.
Yeah.
That's awesome. You guys are great. That's I don't know why anybody would have a baby anywhere except for with y'all. So that's
right.
You're in good hands with Allstate or with y'all.
That's right.
With us.
Anyway, so are y'all? Last question. Are y'all excited about January and February?
Yes.
We're
I've already told them
excited.
no babies, no surgeries, no vacations because we are ready.
There's going to be a lot of babies. Do you have a prediction on how many there'll be? About 100, 200
I'm
extra?
hoping we have over 100 every month, like December, January, February. We'll see.
So I
gonna
bet
be
we do have a
exciting.
boom.
Yeah, I think so.
All right.
Well, we'll see you
Very
all
good.
in 9 months.
We will. Until then, stay Singing River strong.
Bye, guys.